I do the presentation. So thank you for having me here today in this beautiful space with this great group of people. My name is Gretchen Van Wye, and I grew up in the UU community in Harrisburg, Pennsylvania in the 1970s and the 1980s. For the past 30 years, I've worked and trained in the health field, specifically public health. I earned my PhD in epidemiology and public health in 2004, and for the past 20 years, I have served at the New York City Health Department in a variety of roles, and currently I serve as the chief epidemiologist. So I want to stop here and offer a few explanations. First, we in public health get a lot of questions about what is public health? What is that exactly? So I want to explain a little bit about that. So it's bigger than your primary care provider in the hospital system, AKA healthcare, but it takes that into account. It's also beyond health insurance and just promoting good health. Like Unitarian Universalists, scientists have many definitions of things, but generally accepted and used definitions of public health are that public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private, community, and individuals. So you can see it's really far-reaching. That's our definition that we've used since 1920. The United Nations World Health Organization then takes health and defines it, because when we're talking about health, we want to be specific about what we're talking about. So the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Okay, so those are the basic definitions of public health and health. And then we need to define epidemiology. I'm an epidemiologist, and so people have often said to me, what does that mean? And people after COVID, much more likely to know what that means. But epidemiology is the study of the distribution and determinants of health-related states or events in specified populations. So the specified population could be Chatham, Massachusetts. It could be New York City. It could be the United States, or it could be another country, or any geographic area. So to put it all together in terms that a person raised as a Unitarian Universalist like me might say, epidemiology is our approach to figuring out why do bad things happen to our health. So if you were raised UU, you know that one of the first things you get in your religious education experience is a course called Why Do Bad Things Happen? The upshot is that it's not an angry God who's making you get sick or making bad things happen to you. But really, my job as an epidemiologist is to think about why do bad things happen to our health? Why do bad things happen to the health of a population? And then when we look at health, we look at the big picture of all the things that impact health. We use frameworks like the social ecologic model and other frameworks that consider multiple levels of influence. Policy, institutions, community, interpersonal relationships, and then of course individual factors, to understand why particular health outcomes occur. For example, when we're interested in understanding heart disease, we ask not just about a person's nutrition and physical activity behaviors, but also what are the structures around those people that shape their behaviors, like the physical activity environment. Are there sidewalks in their community that allow them to walk? Is it safe in their community so that they feel safe walking? And can they get to and from where they need to go without using a car? We also ask what shapes the food environment. So for example, are there affordable sources of produce and lean, healthy proteins in their community? And even if they have access to those, are they affordable? Are they financially accessible? And do they have the time to make that food and the skills to make that food into a healthy meal? So personally, I've worked in a number of different roles where I've been able to practice this public health approach. And I thought I'd just talk a little bit about what some of those things I've done at the City Health Department over the past 20 years to kind of give the flavor of what that means. So when I started at the health department as an epidemiologist, I first started just conducting data analysis to inform our programs and policies at the health department. So if a program wanted to intervene on heart health, for example, people wanted to understand the prevalence of fruit and vegetable consumption, the prevalence of physical activity, those kinds of things. They wanted to understand that at the personal level, but then we mapped it at the community level. So why does it look different in the West Village than it looks like in the South Bronx? What are the factors around people that might make that look different? I also worked in Harlem with schools to help children control their asthma and prevent asthma attacks in Harlem. So we worked with elementary school children and nurses at each of those schools to make sure that those kids had something called a medication administration form so that they can take the asthma medication they needed to control their asthma and keep them out of the emergency department in a school setting where it was more controlled and we offer more structure than kids might get at home when they're maybe going between multiple households and maybe have parents who are working multiple jobs and aren't able to make sure that they get their medicine every day. I've also worked to shape the policies of the food environment by supporting a number of different kinds of things. So we worked on policies to make sure that only certain kinds of foods were available in New York City schools and New York City institutions. We did things like putting calories on menus. You might go to places now, it's as part of the Affordable Care Act, you see calories on menus at any fast food establishment in the United States. We first successfully did that in New York City. We did it for fast food restaurants, and we put calories on the menu at the point of decision, so you can really know what you're getting into when you're making a choice. We also had a policy on making the sodas only so big in New York City under Mike Bloomberg. That one is the one you might have heard about. Of course, that one didn't happen, but that was when we had our fearless leader, Mike Bloomberg. Now I oversee the registration of all the births and the deaths in New York City. So on average, about 300 people are born every day in New York City and about 150 people die. That changed for the way, way worse during COVID, when we had 2 days when 1,200 people died. So we went from 150 people a day to 1,200 people a day. And we ramped up the epidemiologic curve and then ramped down it over a long period of time. A sharper curve than we saw in the rest of the country, but a very sharp and devastating curve. During that point in time, we stayed working in person to serve the customers who needed birth and death certificates in New York City. Of course, that meant that we had to have people coming in person. It was also at the beginning of the pandemic. In New York City, we're often at the beginning of pandemics because we're New York City. There are a lot of airports, there are people from all countries of the world. I don't know if you remember this, but at the beginning it was hard to get masks. So my staff didn't have masks, even though they were coming in person, and we weren't able to get them because they were being held for hospitals. So my mom was talking to Priscilla, and Priscilla was making masks for certain causes, and she made 100 masks for my staff, and I gave them out to them so that we had masks when we were working in person. So it's that kind of commitment, and it's that kind of work that we do. Just those are a flavor of some of the things that we do to make public health happen in New York City. The birth certificate's really important because people need it to get jobs, they need it to get passports, they need it to get their basic identity. So today, my office issues about 1 million official birth and death certificates each year. If you were born in New York City and you order your certificate, your birth certificate, you will see my name at the bottom. If your name is Emma or Liam, you will know that you have the most popular name in New York City for many years running. We also analyze those data and put out a press release about that. That is our most popular press release at the health department, and we put that around Christmas time every year. As a professor at Columbia's School of Public Health, I teach Masters of Public Health students how to approach health issues from this public health perspective, thinking about not just focusing on the individual, but the system and things around that individual that might influence their health. And when I think about what I do as an epidemiologist, I do think it's informed by many of those same principles that I was raised learning about as a Unitarian Universalist child. So the first thing, for example, is the inherent worth and dignity of every human being. And I'm going to ask, if you can't hear me, can you raise your hand if I ever step afar from the microphone? So the first and foremost is the inherent worth and dignity of every human being. When I think about approaching this as an epidemiologist, I think everybody has the right to health and justice, equity, and compassion. Everybody has the right to have an environment and the situation that they live in that can give them a good chance of having good health. Oftentimes in governmental public health settings, we call this being equity-focused. That's coming under attack these days, but the reality is that some people need help more than others just because of the circumstances into which they were born. In New York City, Our mission is to make sure that everybody can get a fair shot at living a healthy life, and at the City Health Department, we're committed to doing that. It's one of the ways in which we pursue that second principle of ensuring justice and equity for all and compassion in human relations. The third principle, the third UU principle, is about acceptance of one another and encouragement to spiritual growth. My perspective in the City Health Department centers on recognizing that we're all on this learning journey that's both professional and personal as we pursue the improvement of people's health. This is a big thing. This has manifested itself in a lot of different ways, but ultimately for me, it boils down to, in public health, like in many things, no one person has all of the answers or all of the skills necessary to solve the very large problem that recurs generation after generation after generation of why not everybody in the world achieves good health. It takes many disciplines, many sectors, and continuous learning to actually make the progress we need to see to get people in a more healthy state in a collective way. Personally, in the past 20 years that I've worked at the City Health Department, have had an incredible learning journey where I've grown as a person and a professional, and definitely in ways that I hadn't expected when I started out my career, even though I was choosing a mission-driven career. The fourth principle, about a free and responsible search for truth and meaning, is very central to what I do as an epidemiologist. Epidemiology is very concerned with correctly and without bias answering cause and effect questions about health. We spend a lot of time thinking about how to understand an issue and structure questions about that issue so that we can get closer to the truth, and therefore to a successful way to intervene upon a situation to improve people's health. At this time, we're seeing a disinvestment in truth and the data and the systems needed to pursue it in the United States. This is bad for the United States, but science remains and will be pursued in many places in the United States and in other parts of the world. The country may recede from prominence and influence in science, but science goes on and is bigger than any one country. The right of good conscience and observing and supporting democratic processes is also a principle of Unitarian Universalism. Broadly, we in New York City are clear in our role to maintain our efforts to advance truth and serve the people of the city of New York, despite attacks on it from certain parties. The true underlying method is the scientific method, informed by dialogue and engagement with the people we serve. As an epidemiologist, I took many classes in my doctoral program in exactly how to do this. And I, like other epidemiologists trained at accredited schools of public health, am accountable to adhere to a scientific and methodological approach. It's here where I see the application of the right of good conscience in observing and supporting democratic processes, the fifth principle of UUism. It's critical to go beyond methods and scientific inquiry to practice science in a way that is grounded in ethics, including human subject protections, privacy laws, and ethical practices that codify the way research around involving people should occur. This is something essential to public health. It's through ethically following such methods and repeated studies that we form scientific consensus on things like the importance and effectiveness of vaccines, the benefits of mammograms and colonoscopies to prevent cancer deaths, and the importance of a healthy diet rich in fruits and vegetables to creating a healthy gut microbiome. The last two principles, the goal of world community with peace, liberty, and justice for all, and respect for the interdependent web of all existence, of which we are all a part, are also important to understanding and working well in public health. Public health done well is a whole of society endeavor. It requires civic literacy among individuals and integrity of the institutions and policies that form the public health ecosystem. Civic literacy means that people understand how to interact with government and make change in it. The public health ecosystem is comprised of governmental agencies, nonprofit associations, state and local health departments, and many other entities. These together ensure a common set of approaches, practices, and language to understanding public health problems and acting on them. We live in an interdependent web of existence, and it does take an interdependent web of understanding and actors to manage why bad things happen to individual people and populations within this web. One very clear example here is infectious disease. This is where we see that germs don't observe geographies. Instead, they like to get on planes. They like to congregate in places where people live, work, and play. And they continue to evolve no matter what our current understanding of them is, and no matter what people think about evolution. It takes a lot, for example, to make sure that we have the right flu vaccine every year, and that people actually get the flu vaccine. Similarly, in the United States, we see that it's very difficult to improve the food environment when the food environment is mostly controlled by large multinational corporations, not beholden to the laws or regulations of any one country or to a collective understanding of public health professionals. Public health functions when we have peace as well. War disrupts the fundamental systems and structures we need to keep people healthy. Health can be achieved equitably when there is justice for all. For me, as a Unitarian Universalist, my work mission is to continue to pursue that ideal public health vision. All of this said, the actual practice of public health can be incredibly challenging and trying. There are political, financial, and emotional dynamics that can make each day feel like a roller coaster. One of the ways I've been able to manage this, besides talking to my family and friends and exercise and all those kinds of things, is to look to a chapter from a Taoist text called the Tao Te Ching. Now, Taoism was one of the first world philosophies and religions we studied in my religious education program at the UU Church in Harrisburg. We made yin-yang medallions, and I guess we learned about Taoism in a way that you'd teach an 8-year-old about it, but it really made an impression on me. Later in college, in a course on East Asian Studies, I read the Tao Te Ching. It's called the translation is The Way and Its Power, the Arthur Waley translation. One chapter of that has stood out to me and has been a comfort to me since that time. In fact, after rereading it in my early 20s, I made a photocopy of it that I still hang next to my desk. I've always hung it next to my desk. It's the reading I've suggested today, and I'll read it in just a few minutes. It speaks to me of the persistence through the external forces that can pummel us throughout life. Persistence and adaptation and grounding in my core values are what enable me to bend and stand again, like the reed that's so often spoken of in Eastern texts. Sometimes I felt totally obliterated. Sometimes I have felt exuberant. Most days I get through by knowing that I am pursuing a career for the greater good that is aligned with my own and greater values that truly aim to bring respect and wellness of all types to the world. I'll wrap up by saying that I did not learn everything I needed to know in kindergarten. That's a UU who wrote that book. But the things that I did learn in the very beginning of my life as a child in the UU education curriculum helped shape my worldview and continue to be carried forward as I work within my community of public health professionals and others on making it possible for us to live healthier, longer, and more meaningful lives. Okay, thank you. Okay, now I'll read chapter 22 from the Tao Te Ching. This is what I've had next to my desk for the past many years. So it's chapter 22. To remain whole, be twisted. To become straight, let yourself be bent. To become full, be hollow. Be tattered, that you may be renewed. Those that have little may get more. Those that have much are but perplexed. Therefore, the sage clasps primal unity, testing by it under everything under heaven. He does not show himself, therefore he is seen everywhere. He does not define himself, therefore he is distinct. He does not boast of what he will do, therefore he succeeds. He is not proud of his work, and therefore it endures. He does not contend, and for that very reason no one under heaven can contend with him. So then we see the ancient saying, to remain whole, be twisted, was no idle word, for true wholeness can only be achieved by return. Thank you.